The Chinese city of Shanghai is lifting its 2-month pandemic lockdown. Schools, supermarkets, and malls are opening up at reduced capacity. On Monday, authorities reported a total of 29 new COVID infections in the city. And that's proof the lockdown worked. When it was imposed in April, Shanghai had recorded 20,000 new infections. Now, there are plenty of reasons to criticize the Chinese Communist Party and be skeptical of its commitment to building actual communism. But we're not doing that this morning, because there is no question that China, like very few other nations on Earth, committed the full resources of the state to keeping its citizens alive during a pandemic. And it's an attitude that is, well, it's unthinkable to the capitalist press in the West. The Los Angeles Times described the COVID restrictions in Shanghai as, quote, costly, and it dismissed the success in bringing down infections, writing, quote, the success came at a price. Authorities imposed a suffocating citywide lockdown under China's zero-tolerance COVID-19 strategy, which aims to snuff out any outbreak with mass testing and isolation at centralized facilities of anyone who is infected. Huge temporary facilities were set up in exhibition centers and other venues to house thousands of people who tested positive. Teams of healthcare and other workers flew in from around the country to help run the massive undertaking. Yeah, that sounds like what a functioning state would do. What exactly is the cost here? The Times adds, quote, through it all, leaders of the ruling Communist Party repeatedly expressed a determination to stick to its zero-tolerance policy, even as other countries have opened their borders and are trying to live with the virus. Outside economists widely expect China to fall short of its 5.5% growth target for this year. Oh, so that's the cost, GDP growth. Meaningless numbers for unfuckable economists to pore over. In an article titled The Rising Costs of China's Zero COVID Policy, Time magazine writes, quote, China has no intention of following the West into a vaccine-powered living with the virus dynamic. That's bad news for China's own economy and for any diminishing hopes worldwide of avoiding a global recession. Is it bad news, though, for Chinese people who won't die in a frickin' pandemic? Again, what exactly is the cost here? We've got capitalists off estimating what lockdowns in China mean for their own portfolios. They're writing screeds in the Wall Street Journal about how unfair it is that the Chinese Communist Party is trying to protect its own people from a virus. At what cost, sir? Sir, at what cost, I ask? Meanwhile, the New York Times reported on data this week showing that U.S. COVID deaths this year are concentrated among older Americans at a higher level than at any other point since vaccines became available. Last winter's Omicron wave was particularly deadly for older people compared to the Delta wave in the summer. Researchers believe that the stronger immunity that older people had acquired from their 2-dose vaccine regimen plus booster protected them from Delta but began to wane when Omicron came around. The government is encouraging older people to get their second booster, but more than a third of Americans above 65 haven't even received their first booster. And Joe Biden going on TV and just saying, hey, go get your booster, isn't enough to actually get shots in arms. That takes groundwork from public health agencies that so far have been insufficient, at least compared to the Herculean mitigation tasks we've seen the Chinese embark on to save their citizens. The New York Times reports that, quote, in much of the country, the booster campaign remains listless and disorganized, older people and their doctors said. Patients, many of whom struggle to drive or get online, have to maneuver through an often labyrinthian healthcare system to receive potentially life-saving antivirals. Latest numbers show that infections, hospitalizations, and deaths are all once again trending up in the U.S., even as global infection numbers trend down. Deaths do remain at far lower levels than they were during the Omicron surge, but health experts provided a not-so-feel-good reason for that. Many of the most fragile Americans were killed by COVID over the winter, that the virus now has fewer targets in that age group. But at what cost, right? Now, we can sit here and we can try to wrap our minds around this cost-benefit analysis that Western capitalists are operating under, the cost being actual living people dying and the benefit being fictional GDP percentage points. But that would be pointless because no such calculation exists. There isn't even a consideration of the human consequences of profit accumulation. So the answer to the question of how many dead Americans is worth it to meet quarterly GDP targets during a pandemic is a simple one: as many as it takes. Hey, thanks for watching. Hit the subscribe button so you don't miss any of our new videos. Also, if you want to see Means Morning News in its complete form, not just the clips we post here, head on over to Means TV and get access to all our new episodes and our entire backlog, plus tons of other great movies and original TV shows.